So you've broken your radius, which is this bone that supports the hand and moves around the ulna, lets you pronate, and then swings back, lets you supinate, and it's healed in the wrong place. You may have broken your ulna and you're having the same problem. It's interfering with your pronation, your supination, your distal radial ulnar joint may be unstable or painful, and your wrist no longer has a good platform on which to balance. So the way to fix these bones when they've healed in the wrong place is to cut them and then screw them back in the right position. Well, we've got something new to share. I've got something new to share with you today, and that is we can use computerized three-dimensional modeling to define the deformity, work out exactly where to cut the bone and where to put the plate to restore the normal anatomy so we can get the best possible outcome. Because it's impossible to do some of these complex corrections, particularly in the radius and the ulna, if you've just got to rely on your eyes and hands. So what we do is we take a computerized x-ray of the uninjured opposite side, invert it and superimpose it on a computerized x-ray of the damaged or malunited or deformed arm. Then we can see exactly where the deformity is, and we can work out how to correct it. And we use a plate and screws, and we use three-dimensional jigs that are fabricated on the computer modeling that we've already visualized to drill the holes for the screws and plates, to cut the bone, and then when we put the plate and screws on, it's all in the right place. Frequently we need to augment the repair with bone graft taken from the iliac crest. But what this does is allows us to reliably cut the bone, correct the bone, fix the bone so it heals in the best possible position, so you regain your supination, your pronation, you correct any instability in the distal radial ulnar joint, and you can realign the base on which the wrist, the carpal bones move. Now, not only has this been invaluable or made it possible to correct malunions of the radius and ulna, which we couldn't do in the past, it's also let us correct really complex problems. Children that have broken their bones and they've healed in the wrong place and they've had secondary growth attempting to correct the deformity are a difficult problem. But we can also solve these deformities using computerized modeling and three-dimensional jigs to make the cuts in the right place and fix the bones so it works.